Paul de Savary is the managing director of Home from Home Care, who run 11 care homes for young adults with learning disabilities and complex special needs across Greater Lincolnshire. Hello, Paul.
Good morning, Carla.
Hello, thanks very much for coming on. First of all, I just wonder what you make of what we're hearing today. I know we haven't got sort of finer details of the plans, but overall more money going into the social care system.
Well, I think the fact that somebody's actually making a decision after so many years of not making a decision is great. I think the background against this is that there's been for a long time a lack of staff due to the unattractive sort of conditions for employing staff. This has been compounded by vaccination policy, which says you have to be vaccinated. And I think there's 50,000 people who will be leaving the sector as a result of that. And just generally, the staffing scenario is horrible. And that's before you start looking at the money to actually pay for more care. So it's a crisis scenario. So the fact that they're making a decision has got to be good. As to how good the decision is will be another matter.
Just on the vaccines there, you mentioned it being mandatory and some care staff leaving because of it. What have you seen this, Paul, in Lincolnshire?
Yes, I would say that we have ourselves lost probably about 5 or 6 staff, which is sort of 1 to 1.5% of our staff, and we still have a number who have not been vaccinated. And I've actually written to each one of them personally to say, please do get vaccinated, because it's absolutely critical. But I know a lot of other organisations are suffering far more than ourselves.
And I think it's going to be an interesting 48 hours, certainly, until we get the actual announcement and the detail, because it seems that there's those against the plans already, certainly where the money's coming from, the fact it's going to be an increase in national insurance. I mean, are you concerned that might affect or impact the amount of money that does come into the system in the end?
Yes, absolutely. I mean, if you get a fudge and it's not enough, then all it's going to do is to delay the big problem. I mean, how can we face up to the fact that Amazon are paying 30% more for recruiting staff? You know, the reality is we have a choice. When Amazon whack that onto the price of a product that we buy, we either buy it or pay for it or don't. Now, we're in a really tight scenario where we are learning disabilities. We're very fortunate in our case because we are very specialist and we create a whole sort of career for people. But for the mainline sort of care, you know, you just can't do it. So what are you going to do? You in some cases with elder care, you could say, well, we'll just shut beds because we can't get the staff or whatever. But in other cases like ours, we couldn't do that because we're looking after supporting people on an ongoing situation. So we have to find the staff. And it's very limited as to who we can use because we have to be able to use very highly qualified staff who we train and so on. So this is a difficult scenario.
Well, it is, absolutely. I mean, if the money doesn't come or go to the right areas, what happens, do you think?
Well, I think it's pretty horrible. I think it will just be a further delay of all of the issues that have happened up to now, which have been sort of submerged by everything else that's going on, which sounds a bit of a ridiculous way of answering it. But I think that what could happen is that, certainly in elder care, I think that the less people will be able to afford it. There's not enough money to pay staff at the right levels. So that will be a problem. And I think that perhaps in some instances, beds will actually disappear, which will compound a bigger problem. I think in learning disabilities, in our situation, we have 2 beds that are coming up. And actually, we will not have enough staff to staff those beds when they come free. And we've got people waiting to come into those services because we can't take a risk. So one way and another, at the end of the day, it's going to be people that suffer. In our situation, it's young adults with very complex learning disabilities who actually cost a lot of money to the state to support. And if there are delays in them actually coming into our services or equally moving out of our services, then this will actually increase the cost in the longer term that it will cost to actually support them because behaviours then start to develop and so on. So it's not a pleasant scenario if the money doesn't come.
And I know that you don't want to see further delays, and that could happen if this debate about national insurance rumbles on. But what do you make of it? I wondered the fact it would be an increase in national insurance to pay for this and therefore impacting those on lower wages more.
I think that whichever way you look at it, you can't do nothing. So it's the least worst solution that you're looking for. I think there's lots of different debates on NIC. I think if you actually do it on NIC, then you've got to increase the minimum wage or whatever to those people who it's going to hit most, and pay them more if that's the method that it's done. I mean, by which it's done. It's very difficult to know all the intricacies of government and the way of revenue collection and so on. I wouldn't pretend to understand all of that, but if you're going to hurt people in doing this, well, then you need to compensate those people that you're hurting, who are the least well off and the young and so on. So I think you can compensate it through other sort of political methods. As to whether the government will do that or have the foresight to be able to do it, that's a whole other issue.
Well, thank you very much for coming on this morning. Paul de Savary, Managing Director of Home from Home Care, who run 11 care homes for young adults with learning disabilities and complex special needs across Greater Lincolnshire.